Hello viewers, I am Dr. Shailesh Kumar Garge. Today we will see what are the treatment options for multiple breast fibroadenomas. So these multiple fibroadenomas, they are very common, especially in the young girls in the age group of 15 to 30. So fibroadenomas, they are very commonly in a single lump in a single breast, but in 20 to 30% of the patients they can be multiple, and these multiple lumps can be in one breast or in the both breast. So they can range up from 2 lumps to even 30 lumps in the breast, both breasts. So sometimes and their size can vary. They can vary from millimeters to centimeters with a huge giant fibroadenomas. Giant fibroadenomas, anything more than 5 centimeter is called giant fibroadenomas. So when they are multiple and when they are different shapes and size, it is very difficult to treat them. So a lot of patients, they are very worried when they are having multiple fibroadenomas. So in the olden times, we have either option of regular follow-up or scanning to see whether these fibroadenomas are increasing in number or increasing in the size, or they were having an option of going for surgery. But surgery you can consider when there is a single large lump, you can just remove it off. But if you are having a multiple lumps and in the both breasts, and sometimes they are very difficult to treat because you have to make so many cuts on your breast, and your breast will be having so many scars on that multiple places. Even the surgery sometimes is possible only if there is the lump which is palpable with your hand, but sometimes these lumps are less than 1 centimeter or they are not palpable. In that case, surgery also becomes very difficult for the doctor because they are not able to feel the lumps, or they are so small they are not even seen with your eyes when you are operating. So those lumps are left behind, and you or your doctor will feel that you have undergone a surgery and now it is gone, but that is not the case, because a lot of patients, those who come to our clinic, they have already undergone one surgery. They have seen that lump is removed, maybe some part of the lump is left behind, or the other smaller lump they could not remove it. That increases in size and that troubles you over a period of 6 months to 1 year. So so multiple scars, multiple places and small lumps which cannot be removed with the surgery. Now these patients, they are having another new treatment, that is the non-invasive or minimally invasive thermal ablation, that is microwave thermal ablation or radio frequency ablation or cryoablation. These are the treatment methods similar to your needle test which you have undergone for your lumps, that is FNEC test. So this small needle will be placed in your lumps under the ultrasound guidance, same like how sonomammography is done for your lumps. Similarly, these needle will be placed, that is called antenna, and that antenna will be connected to the machine at a particular temperature, whether for a cryo, very low temperature like minus 70 degrees freezing off, which becomes an ice ball and the lumps becomes dead, or extreme temperature of 70 degrees, 80 degrees, 90 degrees of heat is given to those particularly exactly for those lumps with that needle, which will be a very localized thing, and it will destroy that lump at that point. So once the lump is destroyed, it becomes immediately dead, and over a period of time our body's immune system will eat up that dead lump tissue slowly over a period of time, in like 1 month, 3 months, 6 months, depending upon the size of lump, that lumps will disappear. So these are the methods of treatment which can help even treat multiple fibroadenomas, whatever the size of the lumps, especially between 3 to 5 centimeter or less than 5 centimeter, can be treated with this method, and we can stop these lumps. So rather than waiting and letting these fibroadenomas grow, you can treat them at the early stage or the smaller stage so that they don't grow in size and they can disappear. And advantage of this treatment is you can avoid the major surgeries, major cuts on your breast and major scars in future. So cosmetically also your breast will remain whatever it is like that. And the another advantage is that when you surgically remove the large lumps or these fibroadenomas, there will be a vacant space. So whenever you touch your breast after the surgery, you will feel that hollowness in that space. So that will not be there, because this is a gradual process over a period of time. Slowly the dead tissue the lump, dead lump will be absorbed, and that is filled by the surrounding breast tissue over a period of time, which is unlike in your surgery. If you find this video useful, please share with those patients who are suffering with this breast lumps, and they may find it useful. If you have any comments or questions, please put them in the comment box. I'll be happy to answer them. Thank you.